House Leader of the Third Party.
Thank you, Mr. Speaker. Talk about nation-building projects. Let's talk about a BC destroying project that we need to address. Drug poisoning is now the leading cause of death for British Columbians aged 19 to 59, killing more people each year than homicides, suicides, and car crashes combined. The BC Human Rights Commission has been unequivocal. They're independent. This crisis is a human rights violation driven by toxic supply, structural inequities, and systematic discrimination, not voluntary substance use. The solution is simple, Mr. Speaker, and my colleagues in the opposition will probably react the wrong way. The solution is a regulated alternative to the toxic supply. So through you, Honourable Speaker, to the Minister of Health, will this government listen to the experts, evidence and science, and expand access to prescribed or regulated alternatives?
Minister of Health.
Thank you so much, Honourable Speaker. Thank you to the member for the question. Thank you for the focus on a toxic drug supply that is killing people, that is impacting families, communities across this province, and that continues to devastate us all. That's why we must all turn our attention to everything that we can do to help separate people from the toxic drugs, the street supply that is out there. Mr. Speaker, that's why this government has been so focused on expanding access to treatment and recovery options for individuals. Mr. Speaker, prescribed alternatives are part of a suite of strategies to help keep people alive so that we can help move them into treatment and recovery, so that people can get on the road to recovery, Mr. Speaker. At the same time, it's vitally important we continue to use every tool. This is one tool, Mr. Speaker. We're committed to building out this continuum of care for people, to expanding the number of bed-based treatment beds, Mr. Speaker, to expanding the options for people living in rural communities, to making sure that youth get the intervention and the prevention, the education that they need to understand that toxic drugs, that drugs are bad. Mr. Speaker, we're going to continue this work. We're going to continue this work as part of that continuum of services for people so that we can do everything we can, keeping people alive, getting them on the road to recovery, helping them heal, recover, and be the people that they need to be and want to be with their families and in their communities. Thank you, Mr. Speaker.
Member supplemental.
Thank you, Mr. Speaker. Last week in the Cowichan Valley, a shelter ran out of naloxone after an estimated 80 toxic drug poisonings in just 24 hours. We've spoken with pharmaceutical manufacturing companies here in BC that are prepared to create nasal naloxone in this province at a fraction of the cost we're currently paying. While British Columbians pay from up to $80 for a dose, other provinces offer it free. This is totally unacceptable. Over 6,000 people in this province have died since this Premier became the leader of the NDP. Each one of these deaths was a policy failure. Through you, Mr. Speaker, to the Premier, will you work with local manufacturers to produce nasal naloxone in BC? And if not, how will you ensure that every service provider has enough? Thank you.
Minister of Health.
Thank you so much, Honourable Speaker, and thank you too to the member for pointing out another important tool in that suite of strategies to combat the toxic drug crisis, and that is take-home naloxone kits. Mr. Speaker, whether intramuscular or nasal naloxone, we want to make sure that everybody who needs it, who wants it, has access to it. And what happened in the Cowichan Valley last week was just devastating to see, and another example of how the illicit drug supply is changing all the time, and that is why we have to continue. We have to double down on the services that we're providing to people to separate them from that toxic drug supply. Now, I want to make sure the member knows that Island Health looked into that directly. They ensured that the shelter, that the housing, suppliers, providers have what they need. Mr. Speaker, we have undertaken a pilot study looking at nasal naloxone. I'll have more to say about that soon. We are willing to work with manufacturers to look at the options for producing that here in BC to make sure that it is in the hands of people to save people's lives. Thank you, Mr. Speaker.